you guys have any ideas for expanding the access? I mean, you know, like we call Obamacare. Are there any particular ideas or bills that you guys are pushing next session to expand access to healthcare?
Well, I mean, I think probably everybody has their own unique ideas. I know health savings accounts are one that is pretty popular among conservatives. It allows people to talk directly to the doctor, purchase health care directly, instead of a third-party payer. They're buying it and shopping like they would shop for a vehicle or a hamburger. It gives them a lot more choice and options. For the underprivileged, you may not be able to have enough tax income to be able to benefit from a health savings account. There would be a rebate given to them, which would, let's say, $6,000 given directly to them in the form of a tax credit, a fundable tax credit, that they would be able to use exclusively for health care. That's a far cheaper and far less intrusive means of making sure that everybody has access to health care without creating bureaucracies and exchanges and bureaucrats making decisions on whether this procedure is needed or not needed. It allows the individual to do that, and it's cheaper, and it provides, I think, better quality care. It will lower healthcare costs because you're shopping. Anytime you care about the cost, you're going to make several phone calls to see what that MRI costs here, versus a government where you don't care. You just go in and take whichever one's closest. So that's one idea. I'm sure there are others. But to answer your question, yes, we have many ideas that we would love to push if we're given the opportunity. Any other questions?
I do actually. I'm confused about when you said we can opt out. What do you mean by that? If we opt out, does the federal government have to step in?
Well, I think Governor Darr used the term opt out, and
They use the term not comply.
right.
What do you mean by that? I mean, is that clear?
Well, it's not. We're not complying. We're being given the option not to participate. So we're choosing not to participate. Maybe, I mean, we're still debating that. We have the opportunity at least not to participate in the Medicaid expansion. And the thought is based on economics. We don't have good answers for this yet, but based on economics, if enough states don't participate in Medicaid expansion, there becomes, to quote Dan Greenberg, probably maybe offended that I used him, but give him credit. He said that there's a donut hole that's so large it swallows the donut. You don't have Medicaid expansion in all 50 states. You have millions and millions of people who are not covered either by Medicaid or private health insurance. Are they taxed? I don't know. Are they taxed for not having health insurance? I don't know. Is there a tax credit given to them? I don't know. If there is, that's going to balloon the budget of the federal government. Can the federal government? There's just so many questions that we don't have the answer to. But by not participating, and if enough states don't participate in the Medicaid expansion, you could see the entire scheme collapse in the way that its own budgetary demands.
So you did you mean not participate, or do you mean just not comply with the law? Just clarify.
Me?
Right.
Well, whatever the proper term is, we don't have to participate. That's what the term I want to use. All right?
Give the finger to the federal government saying, no, I don't like this one.
Well, you know, my thought is that if we can have a debate here at the state, it's in our hands, if there's a way that we do not have to participate, that's what we should do. Any other?
How much of this is basically just waiting until November to see if you'll win your legislature? Are you waiting this out?
I don't really think so. I mean, obviously, the session's not until January, so November is going to happen regardless if we take the majority or not. And so this will put everybody on record. I mean, are we going to truly represent our Representative Rice said this will go? Are we going to represent our party, or are we going to represent our constituents? And I spoke with several Democrat legislators today. I don't know if they want me to use their name, but I invited them to stand up here with me, and so they're not here. So, I mean, but between now and then, they'll have to publicly say, or they should publicly say, whether or not they're going to vote to grow this in our state, whether they support this large tax increase on every citizen of the state. Thank y'all very much.